Cek, masuk ya. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Hi, guys. So, how are you today? And are you ready to join the last final session of 2020 summer course? I almost mentioned 2021 winter course. Okay, so welcome back to 2020 summer course. And then today, this is the fifth panel. And today, we would like to talk about future direction and policy in information and community base. Today, we already have some great speakers from our professional in the ICT. And also to bring this panel, I would like to say hello to Mr. Surahaya Sumarsana. Good afternoon, Pak Yaya.
Good afternoon, Mas Yopi. Thank you for inviting me in this session.
Yes, thank you, Pak Yaya. Yes, okay. Pak Yaya, what kind of topic will you bring today?
Yes, today I will be delivering a topic about the use of telemedicine during the pandemic, especially in Indonesia. Yeah.
Okay, so today we have several speakers from Indonesia, and also I would like to inform you. Don't forget to fill the presence form. Once again, don't forget to fill the presence form in the chat box because some participants they didn't finish the fill the presence form, and this was no worries because we opened the presence form until 5 p.m. during the course. So make sure you fill the attendance link in the chat box. The committee has already posted the link in the chat box. You can check now. And to kick off this last panel, I would like to give this panel to you, Mr. Suraya Sumarsa.
Okay then. Yes, thank you very much, Mas Yopi, for giving this opportunity to conduct this last panel 5 in our summer course 2020. It's good number, yeah. And today we will have a little bit heavy title called Future Direction and Policy in ICT-based Health Services. Yeah, something like high in the government side, but anyway, maybe I hope you would like to enjoy this session because we will have a great speaker. They are from the government, so the first speaker will be me. So this is very unique panel 5 because I'm a moderator as a speaker as well. The second speaker will be Dr. Gigi Rudi Kurniawan MKes. He is from the Ministry of Health, the Center Data and Information System, and he will be delivering about the opportunity and challenge about the national health policy. And we also have another great speaker from National Food and Drug Agency, BPOM, Ibu Dr. Anda Ratna Irawati, Apoteker MKes. Thank you very much, Pak Rudi and Bu Ratna, for joining our session today. And then the last one, we will have a pre-recorded session from Professor Paul Glassman. He's unfortunately will not able to join us because of the 15 hours time difference. So then we already have the pre-recorded video. Then we will see how he will be delivering the topic about the teledentistry. So then I think before we start today, I'd like to make more shorter. I know that all of you already engaged this summer course 2020 online for, I don't know, 22 days, is it? You started into 26th of October, right? And then every day you join this Zoom session and you are connected to this ICT system, and you are having all the lecture discussion, or you have workshop and many other things. And I hope you can still survive, right? Oh yeah, and also please allow me to greet to all participants. First of all, for Indonesian participant, apa kabar? Semoga semua sehat, ya, masih mampu mengikuti session dengan baik kan? Oke. Okay. And for the Malaysian participant, hello, apa kabar juga? Selain Malaysia, Indonesia, same. Semoga semua sehat ya dan bisa bergabung dengan sesi ini dengan baik. And all to the Dutch participant, goedemorgen. Hoe het met jou? Alles goed? Kun je nog steeds overleven? I hope so, ja. De winter komt eraan, toch? Het werd wat kouder, geloof ik. So then please relax. Feel rustig, yeah. Because today we have a little bit heavy topic about the policy and blah 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 about in the government, how they will direct our future and so on. So first of all, I would like to share one of the my presentation. Now I was introducing all the speaker here. So then, can you see my presentation right now? Is it okay? Good. Is it okay for everyone? Can you hear my voice clearly and also my PowerPoint slide? Mas Yopi, is it okay? Hello? Okay. Yes?
Yeah.
Yeah, okay then. Then yes, I want to make a softer and make it more relaxed about all of you because I know you are having a good endurance from 22 days, right? From 26th of October. So then I hope you are still okay joining the online session. I know it might be tiring, sometimes also exhausted because you have to all the time watching all the screen and so on. So then, yeah, can you still survive, everyone? Is it okay? Hello, anyone? I hope you do not become a zombie, yeah, because every day you are having a Zoom session. And anyway, it's just a joke, just a graphic. If you see the slide is moving, please be aware because you need a rest. Just like me, maybe because every day I have a Zoom session. When I wake up, then I check my computer, then I realize that I have classroom. Then what I do, sometimes I did like this, yeah. This is like a cartoon that there's a professor who every day having a Zoom session, and then in the morning when he wake up and he facing on the microwave and say that where the heck are my students because nobody there, but then the wife's reminding him that no, it's not your computer or your notebook, this is your microwave. Eh? And also if you familiar with Zoom, as you see, there are a lot of funny things happen during the Zoom session. Like then sometime when you are presenting something and maybe your mom is calling you, or maybe you have to check many times, can you hear my voice? Can you hear my voice? Because you're afraid that maybe connection is not too good gitu. And you forgot to unmute your mic and you did a lot of things, but you just like pantomime, yeah. And also you didn't or you forgot to turn off your microphone, and the time there are a lot of noise around you, like the music, someone is calling your name and many other things. So this is just like a relaxation session in the beginning to see many things happen when you are doing the online activities, just like in the summer course 2020. But anyway, I appreciate that you are still joining us with your lot of enthusiasm and optimistic, and I hope you learn a lot from the previous lecture or session. Yeah. Then okay, then I think I will be back to the then I think I need to read all the CV of the speakers today. And here, the second speaker after me, it will be Pak Rudi Kurniawan. He's the head of information system development in Ministry of Health in the Center of Data and Information. Before being appointed as head of information system development in 2020, Pak Rudi, who was born in Yogyakarta in August 1968, served as head of data and information for the Data and Information Center in 2017. Before joining Ministry of Health, he served as a dentist at Ngerambe Health Center District, Ngawi, East Java. He graduated from the Faculty of Dentistry, Trisakti, University of in Jakarta, 1993, and hold of Master in Public Health from Gajah Mada University, Jakarta in 2003. And today he will be delivering a topic about national e-health system, opportunity and challenge. And the next speaker will be Ibu Dr. Anda Ratna Irawati, Apteker MKes. She is now as Director of Drug Distribution and Service in the National Food and Drug Agency Indonesia since 2018. And before that, she was a Head of Planning and Finance Bureau of PPPOM, Director of Drug and Drug Standardization. The education, she holds a Bachelor of Pharmacy from Institut Teknologi Bandung, 1986, and Pharmacy profession in the same university in ITB, 1987, and Master of Public Health from the Faculty of Public Health in University of Indonesia, 2002. And she will be delivering Indonesia online drug sales and control and future policy perspective. The fourth speaker will be Prof. Paul Glassman. Unfortunately, he was not able to join us directly because of the 15 hours of difference in US. Dr. Paul Glassman, or Professor Paul Glassman, is the Associate Dean for the Research and Community Engagement of the College of Dental Medicine at California State University at Elk Grove, California, and Professor Emeritus in the University of the Pacific Arthur and Adjunct School of Dentistry in San Francisco. He has served on many national panels, including the Institute of Medicine, Committee on Oral Health Access to Services, which produced an IOM report on improving access to oral health care for vulnerable and underserved population. Dr. Glassman has had many years of dental practice experience as well. So then today he will be delivering in our pre-recorded video about the teledentistry in US and how the future direction in the teledentistry use, especially related to the national policy. Okay, then I think I will be back to the our agenda now. Then now I will become a speaker for the first session. That in this session I will be delivering about the telemedicine use. I think a lot in our previous session, a lot of speakers already mentioned, already described, already explaining you about all the telemedicine. So that's why, and I think maybe for all of you, the topic is not that it's become so familiar for you now, right? Then, of course, if you got any question, please don't forget to type on your chat box, and also maybe you can raise your hand and so on, and I will record all that, and we will have a discussion in the end of the session. Okay, then let me start my presentation first. Mohon izin pada Pak Rudi dan Bu Ratna, saya akan presentasi pertama. Please allow me to present my presentation first, then it will be followed by Pak Rudi and then Bu Ratna, and then finally we have pre-recorded video from Prof. Paul Glassman. Okay, yeah. So now I convert myself to be a speaker. So then anyway, please relax. Don't be too serious. Don't be too how is that? In maybe in Netherlands we say spannend, yeah. Because if you are too spannend, then you become bloedruk, yeah. So relax, santai. In Indonesian we say santai. In Malaysian, I don't know. Maybe also we can say santai. Enjoy our presentation, and you have a question, please ask for us, and we gonna have a good discussion afterward. Okay. Okay, then allow me to present my presentation now. Okay. Okay, then I hope you can see my presentation here, and I will be presenting for 20 minutes. Yes, then I will also remind to Pak Rudi, Bu Ratna, we will be given 20 minutes of presentation for each, and then after that we will have a discussion. So then the first presentation is about the use of telemedicine during global COVID-19 pandemic, especially in Indonesia. My name is Surahaya Sumarsono, You can call me Yayo for short, yeah. And I'm teaching in the University of Gajah Mada, and also IT consultant for several organizations like Ministry of Health, UNDP, and several companies as well. Okay. Then let me start the presentation. I think in the beginning or previous session, you already show or watch a lot about what is telemedicine here. I just displayed from the WHO 2016. It's just saying simply delivery of healthcare services where patient and provider are separated by distance. So meaning that we have telemedicine, meaning tele is a distant, either only maybe 100 meters or maybe 10 kilo or maybe 1,000 kilo. And we will be using any kind of modality supported by the ICT or the information and communication technology. Either it's very simple one like just use radio, television, telephone, mobile phone, computer, and of course the internet. So then this is a basic explanation of the telemedicine. And regarding to the recommendation on digital intervention for health system strengthening in WHO, it says that basically there are two groups of telemedicine. One is from the client to provider telemedicine, and it is very interesting because in Indonesia we don't have the regulation yet. I mean the proper regulation. Currently it's like relaxation of regulation because of the pandemic. It's telling about the client to provider telemedicine. Again, it says that under the condition that it complement rather than replace face-to-face delivery of the health services. And the next group, we will have what we call provider to provider telemedicine. This is, we already have the regulation in Indonesia from the Ministry of Health, number 20 in year of 2019. So this is, I will also explaining both of them, okay? And back to the 2016, there is already have what we call a survey about the telemedicine use in globally, and it says that more than 50% of the responding member state, yeah, this is there are 70 countries join this survey. There was a specific national telehealth policy in their country, and also there was a reference to telehealth within their national health policy. I think Pak Rudi will explain a lot about the current national health policy in the Ministry of Health right now. Right? And approximately 75% of responding having a teleradiology program. This is I think the most mature telemedicine. This is teleradiology. I think it's already started like 30 or 40 years ago, right? And also there are some like telepathology, remote patient monitoring, teledermatology, telepsychiatry, and so on. And most of the program were operated at national level or below, and relatively few are being operated international. It will become very important for the current situation in pandemic, because if we only operate in a national level, it's quite difficult to exchange all the information about let's say COVID patient COVID data among the countries sometimes. And some of them are still in pilot or informal stage, and 25% of responding country already did what we call evaluation of government sponsored telehealth program. And in the evaluation, mostly is for the program acceptance, quality, access, cost effectiveness, and so on. And the main barrier is usually, I think it's typical, happen everywhere, is like a lack of funding to develop, support the telehealth program, lack of infrastructure, equipment, or connectivity. I will explain later on. Commenting health system priorities, because we have so many health priorities especially in Indonesia, in developing country, and legislation or regulation. Here, this is the e-health of Indonesia. I will give it to Rudi to explain more about what is the current e-health program in Indonesia. And as you know, it is the background that we have a lot of island in Indonesia. As you know that maybe have you already read on the internet, in Indonesia we have 17,000 islands. Can you imagine? It's so big number, yeah. But however, the hospital distribution are uneven. As you see here, mostly all the health facilities are concentrated in western area of Indonesia. It's like in Java, in Sumatra, Borneo, and so on. So as you see, in the Papua or Nusa Tenggara is very little number of there. Also, additional to that, we also have uneven distribution of all the medical specialists. The same as previous slide, it mentioned here that most of them are in western of Indonesia. Is a bit old, the data is 2015, but it says that 83% are in western of Indonesia, 15% is central Indonesia, and eastern Indonesia is only 2%. So then I recommend to all of you, once you graduate as a whatever medical doctor, as a dentist, as a dietitian, as people who works in public health, please go to the rural area, help them, because they really need you. They really need your skill. They really need your competency to increase to the health services there. And here, as you see, the infrastructure challenge in rural area, this is all the equipment distributed by the Ministry of Health in the program of the Telemedicine Indonesia. We brought there like the ECG, digital ECG, computed radiology, the laptop itself, the lab notebook, internet connection, and many other things. They are here. But as you see, we need a modem to connect to the internet, and the connection is very slow. Yeah, as you see here, I capture some picture. I was involved with the Minister of Health to conduct the survey, also to join the implementation team there. It was very nice traveling there. You see, in South Papua and West Papua, we only have very slow internet connection using VSAT, using the antenna here. As you see, it's not properly installed. There is no fence and so on. So maybe something happened there. The connection is broken, right? And also, as you see in Orange Bari, they're a bit luckier than South Sapor, because behind the primary healthcare or puskesmas, there's a tower from BTS, from the provider, and they got a better connection, like 4.6 Mbps. Yeah, but still it's very slow, right? And the Tiang Ohang in Mahakapulu, it took like 7 hours from Samarinda in East Kalimantan by car, and another 8 hours by boat here. So you can imagine that it's very rural area. And yeah, the building itself is very good for the primary healthcare, but the infrastructure is not good. Yeah, it's very slow there, and they need also the medical doctor there, because usually they only stay like 1 year and 2 years and so on. And also sometimes we have to travel by a 4-wheel drive of the car because of the challenge of the infrastructure. So then, as you see, if we have telemedicine in Indonesia, basically there are two groups that already mentioned before. We got a provider to provider telemedicine. If we related to the government program, we have Telemedicine Indonesia, Temenin, and Pak Rudy will explain later on, and also integrated referral system, Sisruta. And from the client to provider, Ministry of Health also have what we call Sehatpedia, this mobile application by MOH. Hospital to client, there are many, like in Sarjito, our hospital near here, we have what we call Tekon. Tekon is in Javanese word, meaning asking, telemedicine consultation. It's like extension from the hospital information system to serve existing patient who already have the electronic medical record set there during the pandemic. So they provided a take on. And also from the primary healthcare, there are many. Some of them are using very simple like SMS or maybe WhatsApp or maybe Line in your country, I don't know. But here is WhatsApp is the most popular one. They serve our patient using WhatsApp again, but this is not a proper telemedicine, but it's allowed because it's now is pandemic. Yeah, like in US also, they are allowed to use Skype and so on during the pandemic, even it doesn't comply to HIPAA from the regulation of the government because of the pandemic. And also, of course, there are many from the private company, from the private provider like the group of Atensi, Healthtech, and so on. So as you see, this is the dashboard of the Telemedicine Indonesia, Temenin. It's quite simple. Web-based, you can make a teleconsultation, you can upload your ECG, You can upload your USG movie. You can upload your DICOM of your X-ray and so on. Yeah, this is the look of the sistem rujukan terintegrasi or referral system provided by the Ministry of Health. This is the Sehatpedia. I think Pak Rudi will explain later about the mobile app by the government. This is Stekon that I mentioned before, belongs to the Rumah Sakit Sarjito Hospital. Yeah, this is to extend to help all the existing patient to make a consultation with the medical doctor inside the hospital. Yeah. And of course, all the activities in primary healthcare I will explain later on. And yeah, there are many private company like the Halodoc, Big Doctor, Good Doctor, and so on, who are providing telemedicine service based on the mobile application, something like that. So this is the history of the telemedicine in Indonesia from the Ministry of Health. Actually, officially it started in 2012 until 2016. They were provided by the private organization outside the ministry, and that's why they had to pay annual rent and so on. And finally, in 2017, the ministry decided to build or to develop by themselves. It's called Temenin, and basically they will serve tele-ECG, USG, radiology, and teleconsultation. And until now, it's already a lot of users doing that, and we don't have to pay every year the annual fee and so on. So, and UGM, especially Faculty of Medicine, Public Health, and here we are now in the team on the primary team, and with the Hospital Sarjito as a developer of the Temenin version 2. This is how the Temenin works. Yeah. Anyway, from participant from the Netherlands, also from the Malaysia, Temenin means be my friend, something like that. Yeah. It stands for Telemedicine in Indonesia, but if we say it in Indonesian word, Temenin means be my friend, yeah, something like that. So how it works is very simple. Each primary healthcare, each district hospital, they should have any kind of mobile device, either this notebook or maybe smartphone and so on, to be connected to the internet, and they will be connected to the radiology device and CG, USG, or even simpler one, just using the USB to copy all the file to be transferred to the notebook and sent to the internet. Of course, we have to fill in first all the data of the patient and so on, yeah, like what we call medical record, and then the resume will be sent to the medical specialist somewhere in a district hospital. If you see the referral system there and so on, then we got the expertise from them back then, and back to the primary healthcare who sending the teleconsultation. Sometimes it's quite simple and easy to use, and yeah, likely they already have a lot of the user and it works well, right? Yeah, okay. And at the moment right now, the hospital already joined the Temenin. It's already 56 of the who giving the consultation, and there are 151 district hospital or primary healthcare who are asking for the consultation. And from the medical doctor itself, the radiology is already 137, from the cardiology is 186, and so on and so on. So the number is becoming bigger and bigger sometimes. And back to the regulation itself, because we are talking about the future direction and the policy, Ministry of Health or the government already launched the regulation in 2019, with the number of the 2019. It says that it's to serve to control the use of the telemedicine among the health service facilities, yeah, from the primary healthcare to the hospital, among hospital and so on. But because of the pandemic, this year, the ministry launched what we call a circular letter. But basically, if you ask for your friend who study in law, yeah, and this is a bit weaker regulation. It's only circular letter, but it is a relaxation of the regulation to allow everyone to use the telemedicine because of the pandemic. So then they can just stay at home and so on and so on to help to reduce all the COVID-19. So this is using the circular letter or surat edaran number 303 to 2020. And also from the Medical Council, they also launched the Perkonsil number 74 in year 2020. Also again to protect, to help all the medical doctor serving their patient using the telemedicine services. And of course, maybe Budana will explain more detail later on about the control of drug and food that are distributed online, e-pharmacy. And still there are many regulation is being conducted like pharmaceutical electronic system, sandbox regulation, and so on. So basically also during the pandemic, doctors has authority to serve their patient for the anamnesis, physical examination, giving advice, diagnose, management drug administration, and so on, yeah, during the pandemic this year. And also from the community itself, like the Atensi is Aliansi Telemedicine Indonesia, the group of a lot of private company who serve telemedicine based on the mobile application system. They also make a cooperation with the Ministry of Health, especially in providing the information education related to COVID-19, to provide correct COVID-19 information, so there is no fake or hoax health information system, and also to minimize unnecessary visit to health facility, something like that. But again, we are still in progress to develop our proper regulation to help to support this kind of activities, because this is client to provider telemedicine service. And how about the Puskesmas or primary healthcare? I think you already joined, already involved in, I think it's 13 primary healthcare, right? Of course, their telemedicine will be very important. Why? Because, yeah, again, besides of the achievement by IT company in implementing doctor-to-patient telemedicine, we should put attention how telemedicine service are implemented in Puskesmas. Telemedicine service and Puskesmas are carried out between doctor and patient or between doctor and other doctor. So besides they already have Temenin to be connected to next level of the referral system in a district hospital, they need also to serve their existing customer or patient. Right? That's why we need to have a proper telemedicine system, to have a standardized telemedicine system to help them to serve the customer. Otherwise, they only use, let's say, WhatsApp or maybe just SMS, which is they are not encrypted properly. There is a problem with the connection. Data is not incorporated well, and so on, something like that. That's why we need to put attention how the telemedicine should be implemented in primary healthcare or Puskesmas, especially Puskesmas who already has the system informasi Puskesmas or primary healthcare information system. In Indonesian word, we call it SIMPUS, system Puskesmas. Then also, of course, we are waiting for the regulation to help them put the medical doctor to the patient directly. And according to WHO, telemedicine has 4 elements that can be utilized in Puskesmas. One is aims to provide clinical support. 2 is useful for overcoming geographical and distant barriers. Number 3 is involve the use of various types of information technology tools. And number 4 is aiming at improving public health. This is some picture that I will show you. Some picture is from various rural area in Indonesia. The previous one was in Mahakamulu in Kalimantan Timur. This one is the same, yeah. I'm hoping that all of you, once you graduated, you visit there to become a medical doctor, then help them, something like that. This is a picture in Oransbari. Again, if you want to have a telemedicine support in Puskesmas, it can increase access to health services for the community, increase accuracy and speed of medical diagnosis and medical consultation at first level health facilities and referral levels that don't have certain health worker. Using ICT that can connect health facilities with referral facilities for purpose such as teleconsulting, teleassistance, teleeducation, and telemonitoring. As you see here, this is one of the medical doctor in Oransbari in West Papua, serving the patient using the telemedicine service from Ministry of Health, Temenin. It was connected by the 4G connection because behind the puskesmas there is a tower, but sometimes they need to have like a satellite connection, and with this is very low speed and so on, something like that. This is the digital ECG, yeah, to be connected to the patient. And again, number 2 is optimizing the role of puskesmas as gatekeeper, because puskesmas can be as first contact of service, continuous service, complex service, and service coordination. Next is be a gatekeeper function for the patient first contact, referral screening, and quality of control. This is picture in Puskesmas Trawan in I think in the center of Kalimantan. Yeah. And number 3 is optimizing the function and authority of the puskesmas at first level health facility to do the patient registration, completing the patient medical record, consultation, communication, information, education, visit and monitor patient virtually, monitoring, reporting data collection of case, and reference. And of course, here, as we can summarize what we should do to make adaptation during the pandemic and the COVID pandemic, we have the public health effort, we have the personal health effort. It will be supported by the puskesmas function, and it will be used to serve the prevention and control of COVID-19 to prevent, detect, and respond, yeah, giving effective and safe health services in a puskesmas. Yeah. So then a recommendation for telemedicine use in puskesmas. Puskesmas can take advantage of telemedicine to improve access and quality of health services. Puskesmas can conduct mapping of the needs so that telemedicine operation would run well. The district or city health offices provide guidance, including meeting the needs related to telemedicine implementation by puskesmas. And Ministry of Health provides support to puskesmas in the regency or city in the implementation of telemedicine. So back to the global issue, how about the other countries who are also facing the same pandemic here? There are many, like just in US, current President Trump, already mentioned that, yeah, telemedicine is very, very important. Even they give some relaxation or maybe some easiness, yeah, to use the telemedicine service, even just use the Skype call and so on, something like that, because otherwise, yeah, people have to go outside and go to the health facility and can be exposed by the COVID-19, right? And so there are many research already being conducted now to see how the telemedicine is being used in many countries in the world. Like one of the papers says that the role of the telemedicine in healthcare during the COVID-19 pandemic in the developing countries, yeah. And also this is one expert says that when I first started working telehealth nearly 20 years ago, the idea was met with much resistance. Yeah, nobody cared about that. But unfortunately, it took a pandemic for many to realize the value of virtual care. Another issue is about the how people around the world are trying to push the government to make a regulation to support them to use the telemedicine. This is global telemedicine. This paper called with the title of Global Telemedicine Implementation and Integration within Health System to Fight the COVID-19 Pandemic, a call to action. And this paper says that most countries, however, lack of regulatory framework to authorize, integrate, and reimburse telemedicine in their care delivery for all patients, particularly in emergency outbreak situation. Two possibilities are currently available for patients: direct to consumer telemedicine with private provider, most relying on out-of-pocket or private insurance, and free solution like using the kind of free application like WhatsApp, Skype, FaceTime, and many other actually is not supported by the government regulation. Also, there is also a risk about the security, privacy, and so on. But anyway, this is pandemic, so it is allowed to use that. Yeah, and also interesting one is WHO in Pan America and Latin America. They already conducted the assessment of the telemedicine use, especially in the government. They did assessment in July 2020, just like a few months ago. This COVID-19 and telemedicine tool for assessing the maturity level of health institution to implement telemedicine services. They have indicators like to measure the organizational readiness, the process, digital environment, human resources, regulation, and expertise. I'm already using now at the moment to help the UNDP, United Nations Development Program, to make an to conduct the assessment of the telemedicine use in Indonesia during the pandemic. One of the tool that I use is this from the PAHO, yeah, this one. And yeah, back to the Dutch. Actually, I've been there. We have been living for 4 years. It's from 2010 to 2014, and I learned about one of them. I learned about what we call healthcare infrastructure. It was initiated by the NICTIS, the Dutch EHR standard organization. I think some of you, the Dutch participant, already familiar with that. From 2003 and 2009, it took like 6 years. They have what we call AURTA. Yeah, this is the national backbone. It will be connected to any kind of health institution, something like that. And the good thing is no clinical data at the backbone, so only index where clinical information resides. Yeah, and this is very safe. They use a lot of the technology there, and also based on the what we call BSN, Burger Service Number. In Indonesia we call it NIK, nomor induk kependudukan. In America we call it Social Security Number. I don't remember what is in Malaysia right now. And once we are connected, we will be like as a citizen, we are we have to have what we call medical insurance. Like this is unresolved. This is card that I used when I was there. It uses also a lot of code here. So when I have having a services from the GP, then GP use his card. I use the card, and the information exchange will be encapsulated and encrypted to and transferred in the national backbone. So it will be connected to any kind of primary healthcare, to the hospital, to the optician, to the apotheke in Dutch word, yeah, and pharmacy and many other things. Yeah, I think we need to have what we call national backbone like here in Indonesia as well. Right? So the future directives here, we need a standardized format. I think Pak Rudy will explain a lot about this. Interoperability and so on is the issue here. Telemedicine courses, yeah, a lot of medical doctors still getting confused. What is telemedicine actually? What kind of service that I can use? What kind of regulation that will help us and many other things. Yeah. Remember also about the ethical, about the responsible, about the privacy, confidentiality, and security, qualification and skill, accreditation, building confidence. Because again, remember, patient must trust the medical doctor because they will give in any information about their personal data and to be transferred using the ICT. So they have to give a trust to the medical doctor because the information will be used to be processed and doing the health services sometimes. Remuneration, yeah, actually now at the moment this already like pilot project in Indonesia as well, in cooperation between, I think you already watch in the previous session, like between the Ministry of Health and BPJS, how the telemedicine will be supported by the insurance. Yeah, cross-border issue. Yes, again related to the now we are talking about global pandemic. How the telemedicine system in Indonesia will be connected to Malaysia, to the Dutch, to the Australian system, and so on. How they will comply with the standard interoperability. How this instrument should be standardized, verification, and so on, licensing. And also, of course, also we need e-health portal and regulation and grievance, yeah, for contact to the government. And of course, World Health Organization already have what we call a global strategy on digital health, so 2020 to 2024, and they have a vision to improve health for everyone, everywhere by accelerating, the adoption of appropriate digital health. So it's very interesting. It's not only about our local or national, it's talking about the global, how every country in the world will be connected with the what we call standardized system, something like that. Yeah, and it has strategic objective like engage stakeholder, build and consolidate global digital health capacity, and so on and so on. I think that's all of my presentation. I hope you can learn something. And so if you have questions, please type on your chat, and then I will summarize and later on we will discuss. So then I finish my presentation here. And then I will